Hello, my name is Brent Nicholson and I'm with Carrum Health, and thank you for watching our video today where we will be introducing you to your new Carrum Health surgery benefit that is brought to you by your employer. We're going to walk through the following topics today, just give you an overview of the new surgery benefit. We'll answer why you would want to use Carrum Health for surgery, who is eligible for the program, how does the program work? We'll walk through an example, and we'll tell you where you can find more information about Carrum Health. So first of all, what is Carrum Health? This is your new employer-sponsored surgery benefit, and this is new for your employer starting March 1st, 2017. And like I mentioned, we are a surgery benefit program for eligible Anthem medical plan members and their dependents. And we will walk through a little bit more detail on who is eligible for the program in just a few slides here. Eligible procedures today include knee replacement, hip replacement, cervical and lumbar spinal fusion, and also coronary bypass surgery. Right now, we work with high-quality hospitals in Northern California and Southern California. So we are partnering with Stanford Healthcare Valley Care, which is in the San Francisco Bay Area, and also Scripps Health, which is down in San Diego. And what you'll see here is that both in terms of the eligible procedures and also the hospitals that we're working with, we're going to expand our offering as time goes on. So we will be adding new procedures, and we will also be adding new hospitals into the fold. And we will be certainly working to communicate any new procedures or new hospitals that are available through the program to you through your employer. So please be on the lookout for that. Why use Carrum Health for your surgery? If you are in need of surgery, we believe that there are three primary reasons why you should consider using Carrum Health, which is a voluntary option for you. You can, of course, still use your regular Anthem medical plan to get your procedure done, but we believe there are three compelling reasons why you would want to consider or take a close look at Carrum Health for your procedure. First of all, we offer personalized support throughout your entire surgery experience. A member of our care concierge team will be assigned to your case and will provide comprehensive support and guidance the entire way. That spans selecting the right hospital and doctor, handling all of your medical records, and assisting with any travel logistics should that be necessary to reach one of our hospital partners. Second, Carrum Health only partners with high-quality hospitals and doctors. So you can be rest assured that we have already done all of the homework in terms of vetting hospitals and doctors that are participating in our program. And we ensure that they offer exceptional results and outcomes in terms of having extremely low readmission rates and complication rates following surgery, and also extremely high patient satisfaction ratings. The third reason you should consider Carrum Health for your procedure is the financial incentive that's put in place by your employer, which is zero out-of-pocket costs. I should mention that there is a caveat to this. So those of you that are enrolled in HSA plans, so such as the consumer-driven health plan or high deductible plan, you are subject to to the federal minimum deductible, which I will explain in a little bit more detail on the following slides. However, for anyone else who's participating from a PPO plan, there are no headaches or hassles with medical bills. You'll know exactly what you have to pay up front, if anything at all. Your co-pays and your co-insurance are completely waived. So all in all, this gives you the potential to save thousands of dollars. And we'll walk through an example very shortly here. If you do have to travel to reach one of our centers of excellence to get your procedure done, all of the travel expenses for the patient and one adult travel companion are completely covered through the program. And that consists of transportation for you to go from home to your hospital of choice, daily stipend that's provided to cover meals and other incidentals, and lodging, which includes the hotel room, tax, and all parking should you drive a car to reach your desired hospital. Now we'll quickly walk through an example of how Carrum Health can save you up to a couple $1,000s on the surgery. So if you see on the left-hand side of the screen, let's consider those who are on the Anthem Classic PPO plan. If you were to use your Anthem Classic PPO plan to get a surgery done, and let's say you had exhausted $0 year to date in terms of your medical spend through the plan, you would be subject to a $200 deductible, and you would also be required to contribute $800 in coinsurance. So your total out-of-pocket costs to get the surgery done through your PPO plan would be around $1,000. Now compare that to Carrum Health, where your employer has waived all of the deductibles, the co-payments, and the coinsurance to participate in the Carrum Health program. So your total out-of-pocket for this surgery experience would be $0, and you would have the added travel benefit of having those expenses covered, as I mentioned on the previous slide. Now, on the right-hand side of the page here, we'll walk through an example for those on a consumer-driven health plan. So those on those types of plans would contribute $1,500 towards the cost of your deductible, and also $1,000 towards the cost of coinsurance, leaving your total out-of-pocket cost around $2,500. Now, if we compare that to Carrum Health, as I mentioned, those on the CDHP plan, because of IRS regulations, are subject to the minimum federal deductible, which in the year 2017 is $1,300. So that amount would be collected by Carrum Health, but the difference, as you can see here, is that all co-payments and coinsurance would be waived. So your total out-of-pocket through the Carrum Health program would be only $1,300. So there is still potential for cost savings here. Plus, there's the added benefit of the travel expenses being covered through the Carrum Health program. Now, this example considers that the fictitious patient in mind has not contributed any expenses towards their medical plan as of yet. So it is certainly possible that someone entering the program would have already spent some money on the medical plan, and so those amounts would be updated accordingly. So if you had already spent $500 towards your deductible, in the far right example, Carrum Health would only need to collect the remaining $800 to satisfy that federal minimum deductible. Now let's talk through who is eligible to use the program. So anyone who has primary coverage through an Anthem Classic PPO, Advantage PPO, or consumer-driven health plan is eligible to use the Carrum Health program as long as you satisfy the following employment statuses. Active employees and their dependents are eligible to use the program. So are early retirees. So these are pre-65 retirees and their dependents who are not yet enrolled in the Medicare program. And also COBRA participants and their dependents. Now we'll use the rest of our time on this video to walk through an example of how the Carrum Health program looks and feels like from a patient point of view. So we'll use a fictitious patient. Let's say her name is Susan, who's a 52-year-old woman who is experiencing pain in her right knee. And after she's been working with her local physician for a while to try out some more conservative treatment like physical therapy, Susan is ultimately recommended knee replacement surgery. So this is a pretty big decision. So let's say Susan is evaluating her options, and she remembers that Carrum Health is actually a new employer-sponsored surgery benefit that she is eligible for. So Susan then would contact Carrum Health, and there are two ways to get in touch with Carrum Health. On the left side of the screen here, you can see that you can directly call our phone number, which we will show at the end of the presentation, and be introduced to a member of our Care Concierge team. Our Care Concierge will walk you through the program, what it entails, what are all the steps, and see if Susan has any questions. Also, we have a website, which is a portal. It's a comparison shopping portal that allows Susan to log in, to create an account, and then view all of the options that are available for her. So this is meant to be an experience where researching your options for surgery is as simple as and intuitive as booking a flight and comparing your airline options online. So whether it's through talking to the Care Concierge or going online through our website, Carrum Health allows you to completely compare the cost and quality information of the options available to you for your surgery. So let's say in this example, Susan notices that Carrum Hospital, a center of excellence, has outstanding care quality, experienced surgeons, and has the potential to save her $1,000 in out-of-pocket costs compared to going to her local hospital that's available to her through her regular Anthem plan. On our website, or our care concierge can help you look at the surgeon profiles that are available through our program. And ultimately, let's say in this example, Susan is really impressed with one of the surgeons that she sees and likes the information about the hospital, so she opts to proceed with the Carrum Health program. The next step in the process would be receiving clearance for surgery. So our care concierge would work with Susan to explain what's next in the process and where we're going to help. One element of how we help is we gather all of Susan's medical records for her after she signs a release form that allows us to contact all of her local doctors and gather those medical records on her behalf, which we then turn over to Susan's chosen surgeon at our Center of Excellence to evaluate the case and validate that surgery is truly the most appropriate course of action and will result in the best outcomes for Susan. So this process takes approximately 1 to 2 weeks, and we facilitate a one-on-one consultation between Susan and the surgeon. If Susan does not live near the hospital area, this consultation would take place over the phone or video conference, and the surgeon would talk through the situation with Susan, what the surgeon saw in the medical record, and whether or not they feel like surgery would be a good outcome for Susan. So let's say surgery ultimately is recommended and Susan makes the decision to proceed with the Carrum Health program. Subsequently, our care concierge really steps into the role of helping Susan fully prepare for her surgery. And that includes scheduling all appointments and arranging all of the travel logistics that are based on Susan's preferences and the employer's travel policy. Our concierge will provide Susan with educational materials, including a full rundown of what to expect, how to prepare for surgery, and a detailed itinerary for the entire surgery experience. This is all delivered in a comprehensive welcome packet. Along with that welcome packet, Susan would receive a prepaid MasterCard in the mail that contains funds for meals and the other incidentals that are covered by her employer's travel policy. And before Susan leaves to get surgery done at our Center of Excellence, our care concierge would call Susan and walk her through everything, do a final run-through of the welcome packet, and provide any final reminders on diet, sleep, and the upcoming logistics. In terms of the actual trip itself to get surgery done, we'll assume that Susan is traveling in from out of the area. So typically the process for joint replacement surgery is about a week. We're using that as an example. So on day 1, for example, Susan would travel with her companion to the hospital location, check into the hotel, and the very first thing they would do at the hospital is meet the surgeon for a face-to-face visit. Subsequent to that, they would complete any pre-op labs, tests, or final workups, and the next day, then the surgery would be scheduled. So the operation would be completed, and Susan would likely spend a day or two in the hospital itself for observation and recovery. Then after that, Susan would be discharged from the hospital back to her hotel room to recover for a couple more days. And if the surgeon recommends it, we would actually coordinate some physical therapy visits to come to Susan's hotel room and help her get a head start on the recovery process. And on the last day of the trip, Susan would go back to the surgeon and have a travel clearance appointment. So this is a final face-to-face visit where the surgeon would check up on her recovery progress and make sure that it's safe for Susan and her companion to begin the journey home. After Susan gets home, our care concierge steps back into the fold and would begin helping Susan transition back into her normal Anthem network for the rest of her post-acute care. So our care concierge would work closely with Susan to schedule any follow-up visits that are recommended by the surgeon, which could include home health, physical therapy, or outpatient rehab. And our care concierge would stay very close in touch with Susan throughout this process to make sure that everything is going well and that we are seamlessly coordinating all the logistics in terms of transferring medical records from the operating hospital to Susan's local providers so that there's no gap in information. Most importantly, Susan would not receive any medical bills throughout this process. Instead, just a thank you note from Carrum Health for participating in the program and offering a simple survey to gather her feedback on the experience. So imagine the difference after getting home from a major surgery like this, and instead of starting to receive a trail of medical bills where you don't really know when they're going to stop, you know that everything has been taken care of and you just receive a thank you note. And then Susan would progress back to function and return to work after going through the post-acute care regimen suggested by her surgeon. So that concludes walking through the patient experience. In terms of where to find more information about Carrum Health, I mentioned there are 2 resources available to you. Number 1, on the left side of the screen here, you can see we have our online comparison shopping tool. This is the portal that you can access at my.carrumhealth.com/ACWA JPIA. And this is meant to provide you with that comparison shopping style experience where you can look at the hospitals that are available to you through Carrum Health, compare those to your standard hospitals available to your health plan, and compare on the basis of cost and quality. Also on the right-hand side of the screen, this is the number for our care concierge service. You can reach us at 1-888-855-7806, and a member of our care concierge team will be able to address any of your questions and tell you more about the program and how it works and what the next steps would be should you be interested in proceeding. That takes us to the end of our video presentation, and we hope it's been informative in terms of teaching you a little bit more about the Carrum Health program. If you'd like to learn more, of course, you can contact us either through our phone number listed here, 1-888-855-7806, or you can visit our website online, my.carrumhealth.com/ACWA JPIA. Thank you very much for watching this presentation, and have a great day.